Bismillahirrahmanirrahim. My name is Dr. Adil, and in this video I will discuss with you latest research published in Lancet Medical Respiratory Medicine Journal in March 2020, that the angiotensin converting enzyme inhibitors and angiotensin receptor blockers may increase the severity of disease in COVID-19 patients. This research was carried out in School of Public Health, Louisiana State University, USA. As all of we know that angiotensin converting enzyme inhibitors and angiotensin receptor blockers are the drugs which are usually used in the treatment of hypertension in the patients having coronary heart diseases, diabetes and renal insufficiency. In our body, renin-angiotensin aldosterone is a mechanism that controls the blood pressure. Kidneys are the first organs which first detects the decrease in the blood pressure, and then from the kidneys renin is produced, and then renin will circulate in the blood, goes into the lungs, and from lungs angiotensin is produced. Angiotensin angiotensin 1 is produced, and then angiotensin 1 will convert into angiotensin 2, and then angiotensin 2 will again secrete into the blood circulation, and then stimulates the adrenal gland to produce the aldosterone, and that aldosterone will then maintain the blood pressure of the body. In cardiovascular patients, we use angiotensin converting enzyme inhibitors and angiotensin receptor blocker drugs for the management of hypertension. Research carried out in Louisiana State University on the animals, in which the angiotensin converting enzyme inhibitors and angiotensin receptor blockers drugs are infused in the animals. It was noted that the angiotensin converting enzyme 2 receptors number have been increased in the cardiopulmonary circulation in those animals. The same findings have been supported by the descriptive analysis of 1099 patients in the China. They were admitted to the different hospitals, and all the patients, they were having cardiovascular diseases, and they were taking the angiotensin angiotensin converting enzyme inhibitors and the angiotensin receptor blocker drugs. And when these patients, when they were diagnosed with the COVID-19, they exhibited severe symptoms, and some of them, they were admitted to the ICUs, and some of them, they were shifted to the ventilators. From this study, it has been proved that the use of angiotensin converting enzyme inhibitors and angiotensin receptor blockers may increase the number of receptors of angiotensin converting enzyme 2. And unfortunately, the COVID-19 virus that binds with the angiotensin converting enzyme 2 and produces the symptoms. So all those patients, they were on the angiotensin converting enzyme inhibitors and angiotensin receptor blocker drugs. They are having more number of receptors of angiotensin converting enzyme 2 in their body. And when they were exposed with the COVID-19 and that virus that binds maximally with these receptors, and obviously the number of receptors, they were more in those patients. They were on these medications as compared to the normal individuals. So those patients, they exhibited more severe signs as compared to the individuals which are not using these medications. So it's proved from this study that the angiotensin converting enzyme inhibitors and angiotensin receptor blocker drugs, they may increase the severity of the COVID-19 in patients of cardiovascular problems. This is all about for the today. Inshallah, next time I will come with some new topics. Thank you very much. Allah Hafiz.